name is David, and when I was 36, I walked into a doctor's office with absolutely no energy. I'm 159 on a good day, stepped on a scale, I was 129, was told I'd lost 30 pounds and I had type 1 diabetes. I was totally overwhelmed. I've been an athlete my whole life, and I had no diabetes in my family, and the doctor gave me a script for insulin and an appointment with the nurse the next day. I needed help, and I needed help now. I went on the internet, a lot of information out there, but it really wasn't personalized to me. And then I was really fortunate to meet a great diabetes educator named Cecelia, and she fit me into her overbooked schedule and met with me every week and gave me the personalized education, support, compassion, and most importantly, the hope that I could live an empowered life with diabetes, which I have, thanks to her. Since then, I've gone on to run hundreds of running races and triathlons, including several Ironman races, and it really shows that diabetes is not a death sentence. It's with the right education and personalized support and guidance, anything is possible. So I went this year to find Cecelia, to tell her that her experience with me helped not only myself, but inspired me to found a company named Fit4D, where we're now helping hundreds of thousands of people. And I found out that she had passed away. And she had passed away of cancer 8 years ago. I didn't know that. And so with the help of the Lighthouse Guild, an ACO in New York City, we tracked down her son, Ken, who lives in Atlanta. And I had the really good fortune of meeting him a few weeks ago. We flew him into New York, and we told him about his mother, who, you know, because of her, helped me and now helped hundreds of thousands of people. And it was an incredibly emotional moment. And we learned that Cecelia had become a diabetes educator. She had been a nurse, and she took the extra training to become a diabetes educator because her own mother had diabetes. So now that you've heard about Ken and you've heard about me, I want to share with you today that in honor of Cecelia, we're renaming Fit4D Cecelia Health. Thank you. It's a tribute to an amazing lady who had the compassion and care and went the extra mile for me, and it really made all the difference. Now I want to share with you a story about one of our patients, Jason. Like me, he was diagnosed with diabetes, in his case type 2 diabetes, and his A1C was 12 when he was diagnosed. And just to give you a frame of reference, anything over 8 is considered very poorly controlled. His physician immediately hospitalized him and told him that if he didn't do something about his A1C, there was a very high likelihood that he'd have a cardiac episode, he would have blindness, or neuropathy, where you lose feeling in your legs or arms. And so he started working with our coach, diabetes educator Wendy, and through personalized interaction, the human touch, helping him initiate and stay on his medications, following the provider's care plan, doing the changes he needed to his nutrition and fitness, he was able to get his A1C down in 3 months to 8.0, and then in the following 3 months down to 5.5, almost as if he didn't have diabetes. It was really an incredible experience for him, and really a compliment to Wendy, one of our educators. And just to give you a sense of the magnitude, a 1-point reduction for Jason meant a 57% less likelihood of a stroke, 50% reduced risk of kidney disease, and a 76% reduced risk of eye disease. So the change he went from 12 to 5.5 was life-changing. And when he voluntarily said, I want to give you guys a testimonial, he really explained that there was no way he would have gotten through this without the personal support, the human touch of a diabetes educator. Now, we're helping hundreds of thousands of patients, and in 2018, we had over 400,000 live interactions. That's more than double that we had in 2017. That's in addition to the email and text and online support groups that we do through electronic touches. And we provide value for health plans and providers by helping their patients who have diabetes, who are potentially poorly controlled or newly diagnosed, or they change their medications, getting them healthier on their medications, lowering their A1C, improving quality, lowering cost. And we're also helping with social determinants of health. The Bold Goal Initiative with Humana, we've measured CDC improvement to the number of healthy days of 3.5 days a month due to the personalized intervention. With pharmaceutical and device companies, we're able to get the patients initiated and persistent on the medication or device, and we're really also strengthening brand loyalty. Every day we're hearing stories from patients. I can't believe company X is doing this to patients. People are crying on the phone. It's really life-changing stuff. And what we've also learned is we had one of our payers, Health First, come to us and say, you know, you're doing great for our members. Hey, can you help our employees? Because we are a self-insured employer. And so we started helping employers as well, and that came from our clients on the payer side. So what we're doing now is we're able to take these 400,000 unique touches and add all the structured and unstructured data together to develop insights and leverage direct input from devices like continuous glucose monitors, pumps, connected pens, feed them to the Apple smartwatch, apps, blood pressure devices, and we're able to apply machine learning and artificial intelligence so that we could bring real-time insights back to patients, the providers, and our clients. This is an incredible way that we're going to be able to use technology to scale the human touch and accelerate our moonshot mission. One of the partnerships I'd like to announce today that gets us to a new orbit in that mission is with the Jaeb Center for Research and the Helmsley Trust. What we'll be doing with them is virtually helping onboard patients to continuous glucose monitoring devices. For those of you who don't know, those devices sit on the body and the data goes up to the cloud and people could see their blood sugar. They don't need to test on a meter anymore. And last year it was approved for Medicare. So this is one of the transformational paths forward in healthcare, but the ability to virtually onboard and help persist the patients on the CGM and then in turn help them understand the data to improve their health is groundbreaking. And combined with the data we get from connected devices and the intelligence that we could provide, we could segment the patients and really provide very, very personalized guidance. They say that one person can make a big difference. Cecelia obviously made a huge difference in my life, and because of her, made a huge difference in so many others. I really want to thank her so much from the bottom of my heart. I'm eternally grateful. Thank you.